Well, China has held its biggest crisis meeting of senior government and military officials since the beginning of the coronavirus outbreak. State media says that President Xi Jinping told the teleconference that it is the worst health emergency in the 70-year history of the People's Republic. And he plans to roll out a series of measures, including tax cuts for businesses to kickstart the country's battered economy. Meanwhile, officials in Wuhan, the epicenter of the outbreak, have introduced 14-day mandatory quarantines for patients who have recovered from COVID-19. The move comes after some discharged patients again tested positive. More than 2,400 people have now died in mainland China. Confirmed cases there are rapidly approaching 77,000. Across the rest of the world, officials report 20 deaths and almost 2,000 infections. Meanwhile, South Korea has raised its disease alert to the highest level due to the rapid rise of the coronavirus cases. At a news conference this morning, the president called the country on red alert. It allows the government to send extra resources to hard-hit areas and to prevent public activities. Health officials reported 169 new infections today, bringing the total in South Korea to 602. Many of the country's new cases have been linked to a church congregation. More than 9,000 church members are in self-quarantine. Since the first confirmed case last month, at least 5 people have died from the virus in that country. Meanwhile, Iran is struggling to contain its own coronavirus outbreak. Rebecca Collard is tracking the latest on this story from Beirut and joins us now. So let's talk about the latest number of people infected by coronavirus in Iran. Rebecca?
Yeah, John. So we have Iranian health officials this morning saying that number is now 43, which is up from 28 yesterday. So a jump of 15 people, which is very significant, John. And on top of that, another death, which brings the total number of deaths in the country to 8, which is also quite a lot considering, as you just said, there's only been 20 deaths outside of China. So we have almost half of those in Iran. So quite an escalating situation there. We also got some interesting details from the health minister today, John, because there was a lot of talk about how the coronavirus managed to make it to Iran. Now, what the health minister said this morning was that they believe that it was actually an Iranian merchant who traveled often to China, who brought the virus back to the city of Qom, and that's where most of the cases in Iran have been, in this religious center, this city of Qom. And that patient has died since bringing the virus into the country. And the last thing I would say is that they said Iran says they actually had stopped these direct flights to Iran, that this person who brought the virus to Iran actually managed to get an indirect flight. So interesting details this morning, and I think a very concerning situation in Iran, John.
So now that it is there, Rebecca, what are some of the challenges to containing it in the country?
Well, one of the biggest challenges, Iran has a relatively good healthcare system, but one of the big challenges is, of course, these U.S. sanctions. Now, the U.S. said that they didn't want sanctions to affect the medical supplies, medicines, pharmaceuticals, that sort of thing. But unfortunately, it has affected that, and it has made it difficult for Iran to get medical supplies and pharmaceuticals. And we're hearing that some pharmacies saying that they're now out of sanitizers, there's a shortage of masks and this sort of thing, and the local producers just aren't able to produce enough. So I think that's the biggest challenge that Iran is facing at the moment in trying to contain this outbreak, John.